In 1996, Nair and his colleague published a histological study to identify two distinct types of cysts that represent 15% of total periapical lesion in their studies: true cyst and pocket cyst. True cyst, completely enclosed cavity with an epithelial lining not directly connected to the root canal system, where pocket cyst had an epithelial lining partially open to the root canal through an apical foramen maintaining a connection. They implies that the presence of a true cyst necessitates careful treatment planning that may involve surgical intervention in conjunction with root canal therapy due to its encapsulation with no connection to the root canal system, which make true cysts are resistant to conventional orthograde endodontics. The study I'm presenting, titled Association Between Clinical Radiographic Characteristics and Histopathological Diagnosis of Periapical Granuloma and Cyst by a Thai group from University of Maydo in Bangkok, which derived from the difficulty that exists in distinguishing between periapical granuloma and cyst solely based on clinical and radiographic features. It aimed to identify clinical radiographic characteristics that might predict the underlying pathology, a granuloma or a cyst in teeth requiring endodontic microsurgery. This retrospective study analyzed data of 83 periapical lesions from 83 patients after excluding any lesion that had been diagnosed histologically other than periapical granuloma or periapical cyst. Based on their finding, 81.9% of the lesions were granulomas and 18.1% were periapical cysts. For the clinical appearance, the periapical cyst group showed a higher prevalence of a history of a swelling or exudate compared to the periapical granuloma group, and the periapical cyst group showed a lower prevalence of history of fistula compared to the periapical granuloma group. The prevalence of history of pus was the same between the two groups. The common clinical diagnoses in both groups were chronic apical abscess and asymptomatic apical periodontitis. For the radiographic appearance, periapical cyst group had a higher prevalence than the periapical granuloma group in multiple teeth involvement, well-defined margin, and partial full radiopic rim, and that the lesion size of the periapical cyst group was commonly larger than 1 centimeter. In the discussion, they consider Nair finding on pocket and the true cyst and correlate them to their finding as a potential guidance for treatment planning decision. Some researchers, including Riccucci and Bergenholz in 2004, disagreed with the claim that surgery should be performed based solely on the appearance of a lesion in radiograph. They suggested that factors such as size, shape, and margin should not be the only criteria for determining the need for surgery. Recommendation for apical surgery based upon a cystic appearance in radiograph must be regarded, and I quote, treatment planning error, and thank you.